the ethical principle is most important. When we work in the hospital, we has to have a principle, right, to beneficial to the patient or not too harmful to patient or to do good for them, right? So in this chapter here, first one is called autonomy. Autonomy means that every patient has a right to make their or his or her own decision, even if it is not his or her best interest. So autonomy or self-determination or freedom to make a decision. So as an example, if a patient is diagnosed by carcinoma or malignant tumor, doctor or you as an RN think the best option of the treatment is a radiotherapy. After discuss with the student or with the patient, they decide not to go for radiotherapy. They like chemotherapy or any kind of surgical remove the tumor. So it is patient right what option they choose. So as a RN or as a healthcare provider, we has to explain what are the patient diagnosis of the disease, what are the treatment option, right? What are the alternative of treatment option? But patient supposed to be the right to choose. So autonomy, basically patient has the right to make his or her own decision, even if it is not his or her best interest, right? And second one, explain, this is called beneficent. So beneficent means something doing good for the patient, right? So beneficence means to do good or what is the best for the patient. I mean benefit for the patient. I want to give you some example. So imagine a patient are chain smoker, or if the patient is smoker, you encouraging them not to smoke, and because of your encouraging, patient smoking is sedation. So it is good for the patient because smoking causes cancer. So it is good for the patient. Like a patient is like swimming in a swimming pool, suddenly drawing or go in the under the water. So you remove them and started the CPR, resuscitation, and starting the breath. So it is beneficial to the patient, right? And another one here, we said like non-maleficence means do not harm, right? So I said you do not do harm to the patient. It's called non-maleficent, right? Example of this, non-maleficent action. As example, I said, stopping a medication that is known to the harmful. So like you are giving the treatment to your patient or medication to your patient, you saw the dose a doctor provide is too high, or the medication it is totally new, you never know that. That times you has to hold this medication. So it means not too harmful for your patient. If you do not know, you don't pretend that you know and you do continue the system. No, you hold it. You talk to the supervisor. You talk to your co-worker. Then you have to do. Always keep in mind, we will do no harm for my patient, right? Another one is called Federality. Federality means always truthful to commitment, what you made to your client. So Federality, we said that keep your promise, right? Keep your promise is the Federality. And next one is the justice. Justice means fairness to all people or equal treatment. So justice means we provide the fairness in care, also allocation of resources. I want to give an example. If like you are waiting to leave your office, you have 30 minutes before to leave. Still, you have 6 patients. So if you have a 6 patient and 30 minutes in hand, so every patient supposed to get 5 minutes. But if you are biased to some patient, someone, and you give 15 minutes one patient and rest of the patient get less minute from you, it is not fair. It is not equal distribution to the patient. So we said when you work with the patient, we will not bias. Always be professional, and justice provide the fairness, right? And last one is here called veracity. Veracity means truthfulness. Tell the truth to the patient. So whatever the patient diagnosis, right? Don't be emotional. Don't lie to them. Just tell to them. Be kind, but you have to tell the truthfulness. If you do something wrong, because you are human, it is not abnormal if you do something wrong. So if your patient get to medication 2 milligram, you give them 20 milligram, unfortunately. So whatever happening, you has to tell to that, you has to tell truth to the your supervisor or healthcare provider. If you do not tell, the patient condition will be bad. But if you tell, the healthcare provider gives some antidote, and it will be good for the patient, right? And you can save the life. So this is called veracity. So all of this is called ethicals or principle: autonomy, justice, fidelity, beneficence, non-maleficence, and veracities. So